How are you doing?
Very good, Jonathan, the pharmacist. May I please ask your name?
Travis.
Travis? Well, nice to meet you, Travis. Can I go ahead and cancel you on your medication?
Yes.
Is that okay if I can do that? Okay, so I see we have Advair. What did your doctor tell you the reason for taking this medication?
I have asthma.
You have asthma?
Yes.
Okay, and how did he tell you, like, what's the expectation? Did he tell you, like, the benefit that you expect from it?
Not specific.
Did he explain how to use it?
No, sir, I didn't.
Okay, well, that's fine. We're going to go over that now. Advair is a brand name for this medication, and the generic name is fluticasone and salmeterol. And what that is, it's a combination drug, and basically they're working together to help you with inflammation and to open up your airways, which is bronchodilation. And one thing I want to mention about this is that it's a maintenance medication, so it's not taking the place of your emergency rescue for in case you have an asthma attack.
Mm-hmm.
So you want to keep this with you. You take it twice a day. Recommend taking it in the morning and in the evening. You want to space it about 12 hours. Basically what happens is if you miss a dose, if it's been at least 6 hours, you can go ahead and take it. But if it's too close to your next dose, then you can skip it and take it. But you want to make sure that you take it only twice. Don't double dose. Some of the side effects, the most common that you can expect is you might get some headache, and sometimes in some patients that you can have an infection in the mouth. Other things to look for, maybe some nausea, vomiting. If anything happens that's way out of normal, you can always call me. You can call your doctor. So those are some of the things you want to you want to look at. Mm-hmm. And the way to use it, one thing you want to make sure that you always keep it, you hold it in a flat like this, because the medication is in powder form. So you don't want to tilt it, then you run the risk of losing some of the medication. So you want to keep it straight up like this, and you hold it like this. And if you look here, what you want to do is you want to push this open like that until you hear the click, and then there is this lever that you want to push all the way. You hear the click. Now it's ready to go. So what you want to do, you want to exhale out, breathe out. Make sure you're not breathing into the mouthpiece. And then this is your mouthpiece. You put it in your lips, and you take a deep breath as much as you can. Hold the breath for about 10 seconds, or as much as you feel comfortable. And that ensures that the medication gets deep into your lungs as possible. And then once you're done, one thing you want to make sure that once you open it, it's ready to use, so don't close it before you use it. Every time you close it, that's a dose that's taken. So to close it back, you just push it back like that until you hear the click. There's a window here that shows you how many doses you have left. Once it turns red, it means you're running out, and it's about time to make arrangements for a refill. And you mind if I ask you to show me if you know how to use it, just to make sure we're on the same page?
Some sort of flaps.
Mm-hmm.
So please.
Yes.
Exhale.
Exhale. Take a deep breath. Hold it about 10 seconds. It's pretty good. Yeah, you did pretty good. Do you have any questions for me?
No, sir.
Okay. Well, I think we pretty much went through everything that I needed to mention with you. And if in case of anything, you have any questions, or you experience anything unusual, call me, call your doctor, and we'll help you from there.
Great.
Thank you so much for your time.
Thank you.
Thank you.